India is pumping hundreds of millions of dollars into vaccine production as COVID-19 infections continue to surge. More than 260,000 new cases have been added in the past 24 hours. Opposition leader Rahul Gandhi is among the latest to test positive. As the virus situation worsens, Singapore is tightening restrictions for arrivals from India. More on that in a moment, but first, a look at day one of Delhi's lockdown.
Delhi, a city of 20 million people, is nearly deserted on the first day of a 6-day lockdown. Just markets are a hive of activity as residents rush to stock up on food and other essentials. Watchful police are on hand to make sure people wear masks and observe social distancing. At the same time, migrant workers are fleeing Delhi by the busloads to escape the restrictions. The exodus is similar to the one seen last year, when India first imposed a national lockdown. The fear is that they will now bring the virus back to the rural hometowns.
अरविंद केजरीवाल जी कह रहे थे कि कहीं किसी को जाने की जरूरत नहीं है, तो उनसे पूछो जो रोजमर्रा की मजदूरी करने वाले हैं वो कहाँ जाएं? वो एक वक्त का जो खाना लाते हैं, एक वक्त की रोजी रोटी कमा के लाते हैं, जिन्हें ये मालूम है कि सुबह से निकले शाम को गए हैं तो 200-300 रुपए कमा के लाते हैं, वो कहाँ जाएं?
India is grappling with its biggest public health emergency, largely blamed on complacency that set in after infections fell. New daily coronavirus cases are above 200,000 for a 6th straight day. The situation at hospitals remains critical, with people fighting for beds, oxygen and medicines.
लॉकडाउन आवश्यक हो गया था, जिस हिसाब से बीमारी का प्रकोप बढ़ रहा था, न तो सरकार उसके लिए बीमारी की बुनियादी ढांचे में मतलब बढ़ा नहीं पा रही थी तत्काल रूप से, इसलिए यदि नहीं लगाती तो ये जो 25,000 प्रतिदिन जो केस आ रहे हैं, ये प्रतिदिन 1.5 लाख हो जाते, तो अस्पतालों में बड़े बुरे हाल हो जाते। हर आदमी बिना इलाज के, बिना इंजेक्शन के, बिना दवाइयों के तड़प के मरता।
Addressing criticism over his handling of the pandemic, Prime Minister Narendra Modi has ordered that vaccinations be made available to everyone above 18 from next month. Vaccine manufacturers are also mandated to supply 50% of doses to the federal government. Nearly 110 million people have received a first dose of the COVID-19 vaccine in India. But that's only a small fraction of the country's 1.3 billion population.
Ishan Garg joins us from New Delhi. Ishan, India's most populous state is seeing a sharp spike in COVID-19, but it is not willing to impose restrictions.
Absolutely. The state of Uttar Pradesh, the chief minister of the state himself has tested positive for COVID-19 and is isolating. And in the past few days, we have seen a 300 to 400% increase in the number of infections. And this is also the state which does not have the best healthcare infrastructure. There are several major cities in this particular state which are almost on the verge of crumbling in terms of their healthcare infrastructure. There are cases that are going unreported, according to experts, because there is some confusion about people not being able to find hospital beds. There are many who are not even able to get tested for COVID-19. The labs which are conducting RT-PCR tests for COVID-19 are saying that they have been stopped by the state government to conduct any further tests until they clear the backlog. So the situation is really bad. And keeping all this in mind, the state's High Court recommended the state government to impose a lockdown in 5 key urban centers. But today the state has approached the country's top court and has got that order turned over. Now, the party ruling the state is also the same party ruling India at the federal level, the BJP. It is fundamentally against lockdowns because it says that the economic activity comes to a complete halt, and people who earn money on a daily basis, they will be hit the worst. So it disproportionately strikes people, and that's why it does not want to impose a lockdown. But experts are saying that in the light of the given rise in cases, and lockdown, especially in major urban centers, is actually the right idea, because without that, India could be seeing close to 300,000 cases overall in the next few weeks if the spike is not curbed.
And how quickly can vaccine production be ramped up then with the boost from the government?
Well, it is going to take a bit of time. Today, we've heard from Bharat Biotech that's producing Covaxin, one of the jabs that's currently available to the Indian population. The company is saying that it's ready to ramp it up to 70 million doses by the end of the year. And the Serum Institute of India, which is bulk producing the Oxford AstraZeneca jab, has today thanked the Indian Prime Minister for the financial assistance. But it is going to take some time to get the facilities up and running, because it's going to require massive changes in infrastructure and also in the labor force that actually creates the vaccine. On top of that, the government has also allowed vaccines that have been approved in the US, UK, in the European Union and Japan to be imported into India, and they will be granted fast-track approval. So we are talking about vaccines such as the ones produced by Moderna, Pfizer, Sputnik V, among others. And that's the hope, really, that once they are able to hit the shelves in India's pharmacies, that a large section of people will be able to get vaccinated. All people above the age of 18, essentially all adults, that's about 1 billion people, will be eligible to get a shot from 1 May, that's next month. So having this extra capacity to produce vaccine as well as have imported vaccine will be useful in that case.
All right, many thanks for getting us up to speed. Ishan Garg in New Delhi.